Robin. My name is Jazzy, and today I'm going to help you, and we're going to learn how to properly brush your teeth and how to properly floss your teeth. But first, we're going to start off, and you're going to show me how you brush your teeth. All right. How many times a day would you brush your teeth?
Every day.
How many times a day?
Twice a day, at night and at morning.
Good. How many times do you floss your teeth?
Every time when I eat something that I'm not supposed to be eating.
Okay. So you should brush your teeth twice a day, like you said, once in the morning when you wake up and before you go to bed. And then you also want to floss your teeth once a day. Okay? So do you know what happens if you don't floss your teeth and brush your teeth daily?
You have cavities.
Yep. And those are bad, huh?
Yeah.
You don't want those.
No.
Okay. So the proper way to hold your toothbrush, you're going to hold it in your mouth like this. And you see the tooth and the gum line?
Yep.
You're going to use the brush and you're going to go at an angle like this. And then you're going to hold it like this. And you're going to brush just like this. Otherwise you can go in circles like this. And you want to spend, like just this area, spend 5 or 10 seconds. And then you move on to the next area, 5 or 10 seconds. And you keep going around and around until you finish all the way. Then you go down and do this way. But instead of your toothbrush being this way, you're going to flip it to this angle so you're brushing this way. Why don't you try it? So put the brush at an angle. Good. So, yep. So put at more of an angle so you get that gum line.
No.
There you go.
It's warm enough where it's fine.
Yeah. So, yep, every day you're going to brush your teeth twice. But every time you brush your teeth, you should brush them for 2 to 3 minutes. So you would do like a whole minute and you would do just your upper teeth. So you would do this side of your teeth, this side of your teeth, and the chewing surfaces. And then you would go on to this one, and you would brush this side of the teeth, the inside of the teeth, and the chewing portion of your teeth. Okay? So what we're going to do is we're going to hold the floss like this, and you're going to go a whole arm length. Yep. And then you rip the floss off. Good. No, I don't have to use that. And now you take it like this, and on this hand, you're going to wrap it 3 times. Good. And then on this hand, you'll wrap the rest of it. Good. And then you'll have about this much room left, and you're going to use your pointer fingers or your thumbs. And you're going to go in between the teeth like a seesaw. Okay? So I'll show you that. So you're going to go between the teeth like this, and you're going to seesaw it in. And then you're going to make a C. See how the floss makes a C? Then you're going to scrape up one side of the tooth and go to the other side of the other tooth and do the same thing. Then you move on. Do you want to try it on this quick? So one side. So make the C. Yep. Then you go up and down. Once you make that C. So, yep, just like that. Do you remember this hand, how we only wrapped it around 3 times? When the floss gets dirty, then you wrap it around that one more time and unwrap it around this one. Not all the way, but then you wrap it up a little bit on that one. Because then the dirty portion travels to that finger. So when you run out of floss, that means that you need to get a new one, huh? Your toothbrush, you should always have a toothbrush with really, really soft bristles. So, because if they're really hard bristles, you can scratch your tooth too hard and you can lose some of your gums, which is this part right here. And if you brush too hard on your gums, if your toothbrush is too hard bristle, then you'll lose your gum just a little bit of it, and then your root will show. The root of your tooth. Like all these, and this, all those.
Oh.
Yeah.
But we
And you
want
don't want that, no.
We just want to press softly.
Okay. Yep, very softly. Because all that sticky plaque, do you remember about plaque? That stuff will come off very easily with the toothbrush. So you don't need to brush very hard.
Uh-huh.
Yep. So, like your toothpaste, this is your toothpaste.
Uh-huh.
And do you see how that says fluoride anti-cavity?
Yeah.
So fluoride is something in the toothpaste that helps your teeth stay healthy. And when you go to the dentist, they might rub some varnish on, which is kind of like a paintbrush. And it goes on like paint, but it goes all around your teeth. And it's like medicine for your teeth. It helps your teeth stay healthy. So that's why you want fluoride in your toothpaste to help your teeth. So this that your mom filled out with you, so you checked mostly all in low risk, but then you had some where you've had a cavity but you have it filled. Because you don't want any of these, that means you're at a high risk for cavities.
Yeah.
So according to this sheet, you're at a moderate risk for cavities, which means that you could get some if you don't brush your teeth all the time or if you don't eat healthy food all the time. All right, well, today went pretty well. You were a very good student,
Thank you.
or patient, and you helped me do this video.
You're welcome.
So, thank you, Robin.
No problem.